first step is introduce yourself and ask for the patient for her musculoskeletal history. Good day, ma'am. I'm Christy Mandang, your nurse for today. May I know your name and your birthday?
I'm Noemi Maria, and my birthday is October 9, 2005.
So, ask ko, ma'am, na kay any previous sports injury or physical injury? Na kay ka-feel nga any muscle pain? Next is inspect the muscle size and compare in the one side of the body. So, ma'am, i-check lang na kung ang imong size imong muscles na ba. Okay, ma'am. Next is inspect the muscles and for the tremors. So, ma'am, check lang na po ang imong mga tendons, ma'am, ha? Hindi na po na ba siya yung sakit? Okay lang, ma'am. Magtintog ka, ma'am. Okay, taba lang. So far, ma'am, wala man po siya any deformity sa imong mga muscles, sa imong bones, and okay lang po siya. So, ang purpose ato is para maibalaan nato if nabay mga fractures ang iyang mga bones o nabay mga deformities sa iyang muscles.
And the next step is testing the muscle strength. Compare the right side to the left side. The first one is sternocleidomastoid. The second one is trapezius. The third one is deltoid. The fourth and fifth one is biceps and triceps. Followed by wrist and finger muscles, and then grip strength.
So, ma'am, mag-assist ko sa imo sternocleidomastoid, ma'am, ha? Dali na sa imo ang niog, ma'am. So, pwede niyo may tuyo kay mga ulo na rin, ma'am. Okay, sa pikas, upward, downward. Okay. Ako ano, ma'am, ha? Dali din ipadulong ang imong ulo, ma'am. Okay, pikas. Okay. So, dali na to sa imo ang trapezius, ma'am. So, pangusog, ma'am, ha? And then, iana din ang imong shoulder, ma'am. Okay, very good. So, dali na po tayo sa imong deltoid. Pwede ni mo yan na imong both hands, ma'am. Upward. Okay. Pwede ni mo i-up ang imong ma'am, shoulder. Okay, next. Okay, so dali na ta sa imong ma'am, wrist. Pwede ni mo yan ang imong hands, ma'am. Ang imong hands. Dali. Upward. Downward. Dali pa flex sa imong fingers, ma'am. Palusog, ma'am, ha? Kung ako ang i-ano ang imong fingers, ha? Ako ang i-press. Palusog, ma'am. Okay. Okay na po, ma'am. Wala man po like, abnormalities or deformities sa imong sternocleidomastoid or sa imong trapezius or sa imong any parts. So, okay na to, ma'am.
So, the purpose of testing the muscle strength is to assess the musculoskeletal and the nervous system by comparing both sides of the muscles. Diri na to makita kung naa ba siya deformities or asymmetry na that can indicate underlying conditions such as ligament or joint injury. And by doing this, you can provide the client treatment care nga mas bagay sa iyahang condition if naa man galing siya injury.
For the lower body muscles, here's how are you going to assess. Good morning, ma'am. Ako ang mag-assessing mo for today. So, palihog lang po cooperate if ever ka na ako ipakuan sa ipahingo sa inyo, ma'am, na, okay? For your hip muscles, ma'am, palihog kog taas sa inyong isa ka tiil and then ako siyang i-resist dayon, ma'am, ha? Okay, sige. Palihog ko taas, ma'am. Sige, 1, 2, 3, okay, good. Bigas, ma'am. Okay, straight lang, mama. Sige, 1, 2, 3. Okay, good naman siya. Okay, next. next, ma'am, is for your hip abduction, ma'am. So, palihog ko bend sa imuhang duha ka tiing, ma'am. And then, try to spread your legs while ako siyang i-resist ko, ha? Okay, sige. Count of 3. 1, 2, 3, go. Spread siya, ma'am. Okay, good siya, ma'am. And then, for your hip adduction, ma'am, imo na sad siyang i-pull together your both legs, and then ako na sad siyang i-resist pa, kuan, pagawas. Okay, sige, ma'am, ha? 1, 2, 3. Okay, very good, ma'am. Okay naman siya so far. And next, ma'am, for your hamstrings, ma'am, ako lang siyang, ako ang i-kibali, i-bend ni mo, i-try ni mo, bend ni mo hantiin, and then ako siyang i-pass straight, ma'am. Okay? Sige. 1, 2, 3, go. Okay? Good man siya, ma'am. And then, karon for your quadriceps, ma'am, opposite na po siya, ma'am. Kibali naka-straight inyong both legs. And then, nakuha siyang i-try open. Kibali, gamay lang siya, di ka siya nga straight, ma'am. Tapos nakuha siyang i-try open lang, ha? Okay, sige. 1, 2, 3, go. Okay, good smart siya, ma'am. Thank you, ma'am. And lastly, for your ankle and foot, ma'am. So, ma'am, ano siya ang dorsiflexion, and this is the plantaflexion. So, kana ako siyang i-try og anay mong kuan, ma'am, hatiin kay para ano na ko siya kung makuan pa ba mong pag-flex yung mga kuan. Sige, 1, 2, 3. Ay, ayun lang siya. Ayun lang pag-resist na. Sige, 5, 6, 7. Okay, pikas, ma'am. Okay, goods man siya. And then, for plantar flexion, ma'am, ako lang siyang i-straight yung doon kataing, ma'am, ha. And then, pagsaba lang kung sakit kayo siya. Sige. 1, 2, 3. Okay, so far, good man siya, ma'am. So, palihog po tindog, ma'am. Kaya i-try na to ang imong pag-uat sa tail, ma'am. Ito lang ka, ma'am, ha. Kibali mga ikatulo ata, ma'am. Kaya para makuha na to ang pag-flexing, ma'am. Both na tail, ma'am, ha. Paano pa na, ma'am, i-brace para kuha siya. Okay, ma'am, ha. Sige. So far, ma'am, all your findings are normal man, ma'am. Wala may any abnormalities sa imuhang mga muscles sa lower part of sa imuhang body.
The next step will be inspecting the skeleton of the patient for structure. So this is done to identify if there are misaligned skeleton of the patient. Okay. Ma'am, can you please stand up po? I'm going to inspect your bones. Stand up straight lang. Can you turn around po? So far, ma'am, there are no misaligned skeleton in your body parts po, so everything is normal. So next will be palpate the bones for to locate edema and tenderness. So this is done to identify the formation of the bones. Okay, ma'am, I'm going to palpate your bones, ma'am. Pwede na tayo kagunitan po. Okay. Tignan ko makabati kag sakit nun, ha? Regarding sa imong arms, ma'am, wala rin siya tenderness and edema po, and everything is symmetric. Pag-proceed na diri, ma'am, ha, sa imong arm. Wala'y sakit na. So, based on palpating your collarbone part, ma'am, is wala ra siya yung mga nodules po nga present. Okay, next, ma'am, is imo legs po. Pwede rin gunitan, ma'am. Okay po. So, while palpating your hands po, wala na siya yung mga edema or tenderness. So, next po, mag-proceed ka sa imo. So far po, while palpating all your bones, wala na siya edema and tenderness. Okay, ma'am, I am going now to palpate your temporomandibular joint. Is it okay if mag-touch ko sa imong face po? Okay. Can you open your mouth widely, ma'am? Okay, move side to side. Then move your chin forward, then downward. So, while palpating your temporomandibular joint po, wala po siya edema and there are no abnormal deformation po regarding that. Okay, so now let's proceed to sperna vascular joint. Okay, ma'am? Okay ra ba, ma'am? Gugunita, tika din na area. Hindi ako kung sakit, ma'am, ha? Palpating your sternoclavicular area, ma'am, wala rin siya yung mga present canutules or tenderness. Okay. Next is your cervical and thoracic and lumbar spine. So, can you please stand up, ma'am? So, I'm going to observe your imong cervical, the thoracic, and the lumbar. So, okay, stand straight lang, ma'am. Then, likod. Okay. So, based on my observation, ma'am, concave ra po siya. Okay, now, ma'am, I'm going to palpate your spine. Can you put your chin in your chest po? Okay. Tingnan ko kung makabating kag sakit, ma'am, ha? So, while palpating your spine, ma'am, everything is normal po. So, pwede na ka mo sit down, ma'am. Next is the shoulder, the arms, and the elbow. So, I'm going to palpate your shoulder, ma'am, also the arms and your elbow po. Gunita, tika ko sa ma'am, ha? Okay, sa mo, ma'am. While palpating your elbow, ma'am, wala na siya asymmetrical na findings po. So, next is the hands and the fingertips. Okay. So, while palpating your hands and fingers po, wala na siya yung tenderness na findings po. Next is your wrist, ma'am. Can you give me your wrist po? Yes po. Okay, regarding to your wrist, ma'am, everything is symmetry. And I'm going to squeeze your, ma'am, your hands po. Ignan ako kung makabati kag sakit, ma'am, ha? Sakit po? Dili. Ikas. Sakit na, ma'am. Okay, so that's normal po. Next is, I'm going to palpate your hips po. Can you please lay down in the bed? I'm going to palpate your, okay, rambutan, ma'am. Hindi na siya sakit, ma'am. So, while palpating your hips, ma'am, wala na siya abnormal findings po. Everything is normal. Wala na siya tenderness and wala na po try deformation. Balik na likod, ma'am. Next is your knees. I'm going to palpate your knees, mama. Okay, ra, ma'am? Okay, ma'am. So, while palpating your ankle, ma'am, and your toes po, wala ra siya abnormal findings. Everything is normal. Wala ra siya tenderness. So, everything is normal po.
First thing we're going to do is to perform a range of motion to the neck. So first is bring chin to rest on the chest. Next is hyperextension. So next is we're going to do lift the head through the shoulder, side to side. Okay, rotation on range of motion is 360 degrees. So we will do a circular motion. Next is shoulder circumduction. This is ROM 360 degree. So now we're going to do a range of motion of fingers and thumb. Next is we're going to perform a hip and knee range of motion, and after is the ankle range of motion. First is the flexion and extension. Flexion, extension. Next is the abduction and the adduction, adduction. Next is internal and external. Next is for the ankle and foot. Next is we're going to perform the range of motion of a trunk. Next is the lateral flexion. Move sideways, side to side.
Lastly is document findings in the client's record using printed and electronic forms.